Assalamu alaikum everyone. Welcome dear all viewers. Today we are going to discuss the classification of antibacterial drugs. Before going to that, I am discussing about antimicrobial. What are antimicrobial? Antimicrobial word is derived from two words, anti and microbes. Anti means against and microbes derived from microorganisms. So we can say that those drugs or those substances which act against microorganisms in order to eliminate them, these are called antimicrobials, or they can also be referred as antibiotics. The microorganisms include bacteria, fungi, viruses, and protozoa. Antimicrobials, if they act upon bacteria, they can be referred as antibacterials. If they act upon viruses, they are called antivirals. Similarly, for fungi, it is referred as antifungals, and for protozoa, it is antiprotozoals. Our focus in this video is on classification of antibacterial drugs. Classification of other antimicrobials will be shared in other videos. Antibacterial drugs can be classified based upon pharmacological action, chemical nature, and spectrum or their generations. First, we classify them based upon their pharmacological action. Antibacterial drugs by way of pharmacological action are cell wall inhibitors, protein synthesis inhibitors, DNA gyrase inhibitors, folate synthesis inhibitors, folate reduction inhibitors, RNA synthesis inhibitors, and urinary tract antiseptics. Now classify drugs of each class based upon chemical nature. First, we discuss cell wall inhibitors. By way of the chemical nature, they are classified further as penicillins, cephalosporins, carbapenems, and monobactams. First, we enlist the drugs of penicillins. Penicillins include amoxicillin, ampicillin, decoxyacillin, dicloxacillin, nefcillin, oxacillin, penicillin G, penicillin V, piperacillin, and ticarcillin. Cephalosporins. We are now going to enlist cephalosporins. These are cefaclor, cefadroxil, cefazolin, cefdinir, cefepime, cefixime, cefotaxime, cefotitan, cefoxitin, cefprozil, ceftaroline, ceftazidime, ceftibutin, ceftriaxone, ceftriaxone, cefuroxime, cefalexin, cefaperazone, and cefodoxime. Now we go to carbapenems, cell wall inhibitors. Carbapenems include doripenem, ertapenem, imipenem, and meropenem. Now we go to monobactams. This drug class has only one drug, and that is aztreonam. Before going to further, we have a point to discuss, that classification of antibacterial drugs by any way is not universal and not applicable on all drugs. The purpose of classification is to understand, learn, and to keep it in mind for the purpose of test, interviews, or telling someone, and either way. Therefore, some drugs remain unclassified, which are now being discussed. We have some drugs in cell wall inhibitors that could not be further classified, and these are colistin, daptomycin, phosphomycin, polymyxin B, telavancin, vancomycin, ethambutol, isoniazid, cycloserine, and ethionamide. Now we discuss protein synthesis inhibitors. Protein synthesis inhibitors by way of chemical nature are further classified as tetracyclines, glycylcyclines, aminoglycosides, macrolides, macrocyclic, lincosamides, and oxazolidinones. First, we enlist the drugs in tetracyclines. It is demiclocycline, doxycycline, minocycline, and tetracycline. Further, glycylcyclines, it is tetracycline, only drug in this class. Now, aminoglycosides. Aminoglycosides have amikacin, gentamicin, neomycin, streptomycin, and tobramycin. Further, macrolides. Macrolides are also referred as ketolides. They have azithromycin, clarithromycin, erythromycin, telithromycin, and rifaximin. Now, macrocyclic. Macrocyclic have only one drug, and that is fidazomycin. Now, lincosamides, it has only one drug, that is clindamycin. Now, oxazolidinones, it is have only one drug, that is linezolid. Now we have other protein synthesis inhibitors that could not be further classified by way of their chemical nature. These are capreomycin, chloramphenicol, and quinoprestin. Now we discuss DNA gyrase inhibitors. DNA gyrase inhibitors upon further classification by chemical nature includes quinolones only. In other words, all DNA gyrase inhibitor drugs can also be referred as quinolone antibiotics. Quinolones include ciprofloxacin, levofloxacin, moxifloxacin, naldizic acid, norfloxacin, and ofloxacin. Now we discuss folate synthesis inhibitor. Folate synthesis inhibitors upon further classification by chemical nature includes sulfonamides only. So these include mephenide, silver sulfur diazine, sulfasalazine, and dapsone. Now we discuss folate reduction inhibitors. It has only two drugs and cannot be classified by chemical nature. These two drugs are pyrimethamine and trimethoprim. Now we discuss RNA synthesis inhibitors. Upon their classification by chemical nature, they include only rifamycins. Rifamycins have three drugs: rifampin, rifabutin, and rifapentine. In the last, we have urinary tract antiseptics. They are referred by this name because they locally act in the urinary tract and eliminate bacteria. This class includes only two drugs, methenamine and nitrofurantoin. Other antibacterials which cannot be classified by any way. These three drugs are pyrazinamide, bedaquiline, and clofazimine. Drugs in each class can be classified further based upon their spectrum and generation. We will learn each drug in separate video. Till to then, please memorize this classification by watching again this video. It will help you to learn and clear your concepts. Subscribe the YouTube channel to get updates. Like this video to support us. Share the videos with your friends and students. Follow our Facebook page. Give suggestions in comment section. Thank you so much for staying with us. Goodbye.